It is a Tuesday morning around 9 o'clock, and you are sitting at the kitchen table with a cup of coffee, going through the mail. The envelopes are stacking up the way they always do near the end of the month. There is the electric bill, the phone bill, a Medicare summary, the statement from the pharmacy, and the one from the insurance company. You are not panicking. You have paid your bills your whole life, and you will keep doing it. But somewhere in the back of your mind, there is a quiet, nagging feeling. The feeling that you are paying more than you should be, and you just cannot put your finger on exactly where it is going. That feeling is not paranoia. In my experience, it is almost always correct. The uncomfortable truth is that for most people in their 50s, 60s, and 70s, money is quietly leaking out in 5 or 6 different places at once, not in big dramatic blowouts, but in small, steady drips. And the reason most folks never plug those leaks is simple. Nobody tells them how. The information is out there, but it is buried under a pile of marketing noise, fine print, and programs that require you to know the right question to ask. Today, I want to walk you through the specific places where smart seniors are quietly saving real money every single month. And I mean real money, not coupons for $1 off soup kind of savings, but the kind that adds up to several $100s over a year, sometimes more. By the end of this video, you will know exactly which bills to review first, which programs most people never apply for, and which habits quietly compound over time into genuine financial breathing room. There is a guide linked in the description below that goes deeper on several of these if you want to take your time with the full details. Let me start with the one that surprises people most, and that is prescription drug costs. I have watched folks hand over $60, $80, even $100 for a medication they take every single month. And when I ask them whether they have ever compared prices, they look at me like I asked them to speak Mandarin. The pharmacy you have been using for 20 years may not have the lowest price. In fact, it very likely does not. Drug pricing in this country is genuinely confusing, and I will be honest with you, it seems designed to be. The same medication can cost $5 at one pharmacy and $50 at another for no logical reason whatsoever. What smart seniors have figured out is that price comparison tools exist and are easy to use. Several well-known apps and websites let you type in a drug name and your zip code and show you prices at pharmacies nearby. GoodRx, for example, has been around since 2011 and has helped millions of people discover that a medication costing them $40 at a chain pharmacy is available for under $10 at a warehouse store or independent pharmacy 2 miles away. The savings on a single maintenance medication, something like a common blood pressure drug or a cholesterol pill, can easily run $30 to $50 a month once you find the right source. Prices vary dramatically, even within a few miles of each other. Beyond that, many drug manufacturers quietly offer patient assistance programs for people on fixed incomes. AstraZeneca, Pfizer, and Johnson & Johnson all run programs that can provide brand-name medications at little or no cost to qualifying patients. Yet enrollment rates remain remarkably low because the programs receive almost no public attention. You do not hear about these because there is no incentive for anyone to advertise them loudly. Ask your doctor's office staff about these programs. They often know about them. And always ask your pharmacist whether a generic is available. The active ingredient is the same. The price difference is often enormous. The next place money disappears without a sound is in insurance premiums. Not because you are overpaying by a wild amount on any one policy, but because most people have not reviewed their coverage in years. Life changes. The house is paid off, or nearly so. The kids are grown. The car you are insuring is older now. The coverage that made sense when you had a 40-year-old house full of valuables may look very different from what you actually need today. I used to believe that loyalty to an insurance company meant better rates over time. I stopped believing that. Insurers often give their best rates to new customers. Long-term customers sometimes quietly end up subsidizing those introductory deals. Call your insurance agent once a year. Ask them to walk you through your policies line by line. Ask specifically whether any coverage is duplicated across your home, auto, and supplemental health plans, because duplication is more common than people realize. And ask whether bundling your home and auto with the same carrier would reduce both premiums. That single conversation has saved some folks I know a couple $100 a year without changing their coverage at all. It takes maybe 30 minutes. Now let us talk about property taxes, because this is one of the most reliably overlooked savings available to older homeowners, and it is also one of the most underused. Most states and many counties and municipalities offer some form of property tax relief specifically for seniors. It goes by different names: a senior exemption, a homestead credit, a freeze program. What it means in practice is that once you hit a certain age, often around 65, you may be able to reduce or cap your property tax bill simply by filing an application. Some programs are income-based, meaning lower-income seniors qualify for larger reductions. Others are available to virtually any homeowner above a certain age. The reason most people do not use these programs is not that they are hard to apply for. The application is usually a single page. It is that nobody sends you a letter saying you qualify. You have to know to ask. Call your local county assessor's office or look at their website and ask specifically what senior property tax relief programs are available and what the income or age requirements are. In Illinois, for instance, the senior citizen's homestead exemption can reduce assessed value by $8,000, which translates to a meaningful reduction on the actual tax bill, depending on the local rate. Texas offers a homestead exemption of at least $25,000 off the appraised value for homeowners 65 and older, and many school districts in that state layer additional local exemptions on top of that. I have seen people save several $100s a year on this one step alone. It is one of those things where the money has been sitting there waiting, and all it takes is a phone call. Let us talk about utilities next, because heating and cooling costs are one of the biggest monthly expenses for most households. And there is a federal program that far too few people know about. It is called LIHEAP, the Low-Income Home Energy Assistance Program, and it helps eligible lower-income households pay heating and cooling bills. In the fiscal year 2023, the program distributed over $4 billion in assistance, yet participation among eligible households consistently runs below 40% nationwide. Eligibility is based on income, not age, but many seniors on fixed incomes do qualify. Your state runs the program locally, so eligibility rules and application processes vary. But it is worth looking up your state's LIHEAP office to find out whether you qualify. Beyond assistance programs, there are practical things worth doing around the house that genuinely reduce what the utility company charges you. Whether stripping around doors and windows, for instance, is one of those old-fashioned measures that has been working for generations and still works today. A door with a bad seal lets conditioned air out all winter and all summer, quietly running up your bill. A tube of weather stripping from the hardware store costs a few dollars. The payoff shows up in your bill within a month or two. I keep coming back to these old mechanical fixes because they do not require a subscription, a smart device, or a new app. They just work. The guide linked in the description walks through a broader list of these household savings measures if you want to dig in further. Now, I want to talk about phone and internet bills because this is an area where I think a lot of folks are simply overpaying out of habit. The telecom industry is not kind to loyal customers. If you have had the same phone plan for several years without calling to renegotiate, there is a reasonable chance that newer, cheaper plans are available to you, and nobody has told you about that. Several carriers now offer plans specifically marketed to seniors, with lower monthly costs than standard plans, sometimes significantly lower. Consumer Cellular, for example, has built its entire brand around serving customers over 50, with plans starting well under $30 a month for basic talk and text. AARP has partnered with at least one major carrier on discounted plans for members, and similar arrangements exist through other senior organizations. The same logic applies to internet service. Call your provider and simply ask what the lowest monthly rate is for your current speed and whether any promotions are available. If they say no, mention that you are considering switching to a competitor. That single sentence has a remarkable effect on the conversation. In my experience, the customer retention department has a lot more flexibility on pricing than the standard billing line. You may not always win, but you have nothing to lose by asking, and the 5-minute call can save you $10 or $20 a month going forward. Subscriptions are another slow drain worth examining carefully. I will be blunt here. Most people I know are paying for at least 1 or 2 subscriptions they have forgotten about entirely. It might be a streaming service they signed up for during a trial period, a magazine they never read, a membership fee that auto-renews each year without asking. Go through your last 2 months of bank or credit card statements and highlight every recurring charge. Then ask yourself honestly which ones you have actually used in the last 60 days. Cancel the rest. This sounds almost insultingly simple, and yet in my experience, most people who do this exercise find at least $20 or $30 a month in subscriptions they had genuinely forgotten about, sometimes more. Let us move to something that does not feel like saving money at all, but absolutely is, and that is preventive health care. I know that sounds like advice from a pamphlet, but hear me out. Medicare covers a wide range of preventive screenings, annual wellness visits, and vaccinations at no additional cost beyond your existing premium. Specifically, Medicare Part B covers colorectal cancer screenings, mammograms, bone density tests, diabetes screenings, and the annual wellness visit, all without requiring you to meet your deductible first. Many seniors do not take full advantage of this. An annual wellness visit is not just a physical. It is also an opportunity to review your medications, flag anything that may have changed, and potentially catch something early when it is far less expensive to address. Catching a health issue early does not just save you suffering. It saves you money. A condition managed early almost always costs less than the same condition managed after it has become serious. I want to say something plainly here. The best money-saving move many people can make is not skipping the doctor. It is going more consistently. Use what you are already paying for. Now let us talk about grocery shopping, because this is where a lot of the daily savings add up. Many grocery chains offer a senior discount day, typically one day a week where shoppers above a certain age, often 55 or 60, receive a percentage off their total bill. Fred Meyer offers a 10% senior discount on the first Tuesday of every month. Harris Teeter, Kroger-affiliated stores in certain regions, and many independent grocers have similar programs. These discounts are rarely advertised at the front of the store. You usually have to ask customer service or know to look for the sign near the customer service desk. The discount varies by store, but even 5% off a weekly grocery order adds up meaningfully over a year. Store brands are the other half of this equation. The way I see it, buying name brand canned goods, cleaning supplies, or over-the-counter medications when a store brand equivalent exists is simply paying extra for packaging design. The quality difference in most categories is marginal at best. I used to buy certain brand name products out of pure habit, the same way my parents did until I actually started comparing labels. In many cases, the ingredients are identical. The price is 20 or 30% less. That difference, spread across a full grocery cart once a week, adds up faster than most people expect. If you are not already part of our community here on this channel, I would love for you to join us. Subscribe and leave your questions in the comments. I read them and I do my best to answer. A lot of what I cover in these videos comes directly from questions people like you have been kind enough to ask. Let us talk about banking fees, because they are one of those things that sit quietly in your account statement and rarely get questioned. Monthly maintenance fees, ATM fees, minimum balance requirements. These vary widely between financial institutions, and many seniors are still paying fees on accounts they have held for decades without checking whether better options exist. The average monthly maintenance fee at a large commercial bank runs between $12 and $15, which is between $140 and $180 a year, simply for the privilege of keeping your money there. Credit unions, in particular, tend to charge lower fees than large commercial banks, and membership requirements are often less restrictive than people assume. Many credit unions serve broad geographic areas or professional communities, and membership may simply require living in a certain county or working in a certain industry, even decades ago. Call your bank and ask directly, what monthly fees am I paying, and what would it take to eliminate them? Then call a local credit union and ask the same question. The comparison is worth making. Even a $10 monthly fee is $120 a year that could stay in your pocket. The last area I want to cover is one that does not often come up in these conversations, and that is the quiet value of bulk buying for things you genuinely use regularly. I am not talking about buying a 48-pack of something you might use twice and then forget in the back of the pantry. I mean identifying the 5 or 6 household items you use without fail every single month. Paper goods, certain canned foods, soap, cleaning supplies, batteries, and buying them in larger quantities when they are on sale. The unit price is almost always lower when you buy more. If you know you will use it, buying ahead when the price is good is one of the oldest and most reliable savings strategies there is. It requires nothing but a little extra shelf space and a willingness to think a week or two ahead.